I thank Dr. Juan Pablo Lievano for dubbing this video in English. On this practice, we will demonstrate how to correct a wound when its edges have different height, one higher and one lower. On the porcine skin specimen, design a horizontal wound about 4 to 5 centimeters large. Do the incision according to your design, with the scalpel angled 30 degrees and securing your hand support, as previously explained. Extend the cut to full thickness of the tissue, including the subcutaneous fatty tissue layer. In order to produce the difference in height between the wound edges, grab the skin on one of its borders and do an incision in the layer under the dermis and parallel to it. This way, separate the dermis from the subcutaneous fatty tissue. And now, through this incision, remove a segment of subcutaneous fatty tissue. Do some pressure over the same side of the wound to make sure it's now depressed. In order to maintain the height difference between the wound's borders during the practice, do a deep stitch on the subcutaneous fatty tissue of the unmodified side of the wound, attaching it to the deep dermis of the side where the fatty tissue has been removed. After knotting this stitch, the height difference between both of the wound's edges will be maintained. Now, we will demonstrate how to correct the asymmetry between the edges of a wound. When correcting this type of wound, we must do a high bite on the highest edge and the lower one on the lowest edge. Begin this wound's correction holding with your claw dissection forceps the highest edge at the center of the wound. Introduce the needle through the epidermis and exit through the superficial dermis. Retrieve the needle and now grab the opposite side of the wound, which is in a lower position. Evolve and present the wound's edge. Insert the needle deeper through the subcutaneous fatty tissue and retrieve the needle. Perform the knotting of the suture, beginning with a double loop and then continuing with simple loops until finishing the knot and leveling the wound's height. Now cut the suture and continue in the same way, doing simple stitches. Entering high through the highest edge of the wound and lower on the lowest or depressed edge. Knot the suture in the same way and continue doing stitches throughout the whole wound until leveling it correctly. Continue closing the wound, doing separate stitches, entering high in the highest edge and elevating the lowest edge in order to find the correct place to insert the needle and level the wound. We have concluded the wound's closure, and the leveling of it has been achieved. This is how the wound initially looked like. Thank you.